Hi, I'm Dr. Alexandra Filangeri, registered dietitian, doctor of clinical nutrition, and I'm sitting here with world-renowned plastic surgeon,
Dr. Thomas Romo, a plastic surgeon in New York City. I'm here to introduce you to our new podcast, We Got Your Number.
We are here to break down evidence-based information and real-world experience, and we're going to bring in some of the top experts in the world because
We got your number. How can we improve diabetes treatment in this country?
let's bring in experts and really talk about what supplements actually
Can
help.
we improve our sleep health by using these medications?
How much protein do people really need to
Can
eat?
nutrition solve all of our problems?
What happens if someone comes off their weight loss medications? Hi, and welcome back to the We Got Your Number podcast. I am here with Dr. Dina Peralta-Reich, double board certified physician in obesity medicine and pediatrics, owner of New York Weight Wellness. She's doing amazing things in the world of obesity and menopause. Welcome to the podcast.
Thank you, Ali and Dr. Romo, for having me here.
So today we're talking weight loss medications. And so, of course, we wanted to bring in an expert on weight loss medications. So I first want you to just kind of set the landscape for me and let the general viewer know, what do they need to know about these medications?
So much, right? Number one is that they are safe and when they're used correctly. And now we know so much about them. There's so much evidence base that everybody should be on it. No, I'm kidding. But honestly, I mean, these medications are changing the world. It's one
Right.
of the best things that have happened to medicine. And new studies keep coming out. And it's just fascinating what's happening, especially in the US where the incidence of obesity is so high. And together with obesity, we see all the comorbidities like diabetes, hypertension, high cholesterol, cancers, Alzheimer's. And we know that this type of medications have an impact on health.
Yeah. And I think you bring up a good question. So who should be on them? And I think it may stretch past, just obesity. So speak to me. Who is a good candidate for these medications?
Many people. So in the past, we were like always just think about overweight or obesity, but now we know that there's so many comorbidities that benefit from this type of medications. We know that the semaglutide, for example, it's FDA approved for fatty liver, for cardiovascular disease, for obstructive sleep apnea, and we know that there's so many studies coming out that we see the benefits of this type of medications in patients with dementia, stroke, post-stroke, and of course we know diabetes, hypertension, cancers. So there is a lot. I mean, who can benefit of these medications? A lot of people.
Now, I want to talk about one interesting piece of the equation. And I know that, you work across the spectrum with weight and you work often with patients that struggle with conditions like binge eating disorder. So could you talk about, in your experience, how have these medications helped patients with binge eating disorder?
That's a great question. Actually, it's changed the way that we treat, the way that we assess binge eating, because we could see the impact of the medication. We could see the benefit on the quality of life, on their activities, their relationship with food and themselves, right? So it's very important that patients with disorder eating, like binge eating, that are a good candidate for these medications are monitored closely though, right? Because there is a very fine line when we're looking at disorder eating. We have to make sure that they are getting the right nutrients, that they're putting the right food in their bodies, not just that we are decreasing the appetite, but we have to make sure that they are getting the right nutrition and that this is not interfering with their regular mental health.
Right. So what I'm hearing you say is it is the holistic care in the sense of the medication is a useful tool, but then the quality of the foods that they're eating and then the relationship with food has to evolve as well. And that's like when you bring in all those disciplines, right? Like therapy and psychiatry and nutrition and
Yeah, of course. A patient with binge eating disorder,
yeah,
disorder cannot just be treated with a GLP-1 and you
course.
could expect that everything will be fine, because we know that people actually could, you know, eat on top of it. And it's the quality and the quantity, because you could be on GLP-1s, but then if you're not choosing your nutrients correctly, then the results on your body composition actually could be detrimental, because what we tend to see is an increase in fat mass and decrease in muscle mass when it's not used correctly.
You bring up a really important point, and I think it looks into two areas. So, how important is it for in-person visits when it comes to weight management on weight loss medications?
I think it's very important. I am not saying that telemedicine is not an excellent tool, but there's something to be said by in person, right? You get to know the patient, physical exam, right? If I'm looking at a person with obesity or with overweight, I want to make sure that there is no signs of insulin resistance. Although you could ask all these questions to the patient, but they need to know exactly what they're looking for. And so I always prefer, obviously,
Right.
to see my patients in person. And when we don't have that opportunity, then telemedicine, but with the right tools, right? I will not do a telemedicine patient without a body composition analysis, without evaluating laboratories. So those things are very important, because I cannot just go by what I'm looking at through a screen and what the patient is telling me, how much the patient weighs, not knowing what their muscle mass is, not knowing what their visceral fat is. So these things are important. And of course, blood work. I like to know where I'm starting. If the patient has elevated hemoglobin A1C, how are their lipids, how are their lipoproteins, vitamin levels, hormone levels. So yes to telemedicine as long as it's done correctly.
And how often do you use tools like body composition analysis?
All the time.
Yeah.
100%. Sorry, I didn't even let you finish that question. It's because to me, it's like, not negotiable. I need to know my body composition.
Right. And then you tailor your treatment towards their body composition.
Of course, of
Yeah.
course. And, when we talk about weight wellness, it's really important not to just think, oh, okay, if that person doesn't have obesity or is not overweight by the eyes, just by looking at them. We cannot label, oh, you don't need GLP-1s, because until I do a body composition, I mean, we see all the time what we call skinny fat, right? People that walk around and they look slim,
Right.
or they don't look overweight to the simple eye. But when we look at their body composition, we could see that their total body fat percentage is elevated, that they have high fat, visceral fat, that their muscle mass is low. So, it's important. It's important to assess body composition, because that will determine also who's the right candidate for that
Right.
that group of medications.
Can you give me an example of a patient that you feel, not a specific patient, but a type of patient that you feel is really maximizing the efficacy of their medication by diet, lifestyle, and so on?
Oh, so many of my patients, I'm so proud of them, because they really make the effort and they are able to change and modify lifestyle. So the way they look at the medication is a tool, right? It's not a magic pill like a lot of people try to label it, or, it's not the lazy fix either.
Right.
So when they come to me and I start them on GLP-1s, it's not just here's your prescription. We take a very thorough assessment of lifestyle, family history, emotional health, nutritional history, and we start working on modifying things. So I have so many patients that have lost significant amount of weight, are able to lose all that in fat mass, and through the process maintain muscle mass and eventually increase it. So that to me, it's like, that's what makes my day. When I see a patient and I look at their body composition and you see That's what needs to happen. And you know that it's not only the medication, because they would never be able to have those results if they were not doing the work.
Yeah. And how important is it? I know this is a silly question. How important is it to gain muscle on weight loss medications?
To maintain muscle mass,
Yeah.
it is not optional.
Right.
It should be the goal. And then to increase muscle mass, well, then that's when we get into a different level, right? But the goal initially is to maintain muscle mass, not to lose muscle mass in the process. And then when we reach where, our ideal body composition, then we always want to push for more muscle.
Can you talk a little bit about intermuscular fat?
Oh, it's there. It's there. So, like, there's the research that shows that we know that there is intramuscular fat. So I find at the beginning, when we start the process with weight loss medications, there's always a small percentage of muscle loss. But that should be very small, and it should stop. Right? It's not something that we should see continuously. Normally it happens on the first month, second month, that the patient starts on GLP-1s if there is a very high fat percentage in the body. But then eventually that should stop, plateau, and then the patient, if it's eating enough protein in their diet and they are, also doing resistance exercise, the patient should be able to maintain and eventually improve, depending on the protein intake.
Let's talk about protein intake a little bit. Why is it important? What are the sources of protein that you tend to recommend?
Protein is life, right? Because muscle is life. We know that if we are trying to achieve a healthy, you call it longevity, a healthy life, healthy years, you need muscle mass. Okay. And what type of proteins do I normally recommend? Well, that's very personal on the patient, right? I personally prefer animal protein, but I do have patients that are vegetarian, that are more, they gravitate towards plant-based protein. So regardless of which protein you utilize, you just have to make sure that you're getting your right amount. And when we're talking about plant-based protein, we just have to also keep in mind what's the quantity that we need to be able to fulfill our protein requirements, and also keep an eye on how many carbohydrates are coming together with the protein.
Yeah, that's so important in the sense that beans are plant-based protein, right? But
Yes.
to get 15, 20 grams of beans, one, it's high volume, which can be a struggle for a patient on a weight loss medication. And secondarily, it's high calorie for a
Yes.
person on a weight loss medication.
Yes.
So it's important. So it sounds like your views align with like the individualized care piece of it.
100%. 100%, because you cannot have a book, a pamphlet, instructions, a one-size-fits-all for patients, because patients are individual. And when we talk about weight is very individual. So you cannot just assume that, okay, this is the recommendation. You go from this dose to that dose and that dose, and you start incrementing. And or that you're going to hand a patient a diet and it's going to work for them. And especially, I don't believe in diets. I mean, I think diets are overrated. They don't work, because what I do believe are changes in lifestyle, in nutrition, that are sustainable in the long term, where the patient is not restricting, the patient is enjoying their food, so they continue to have a good relationship with food, and something that is not going to be yo-yoing in the long term.
Right. So it seems like it's really important to find a physician that is not going to just hand you a piece of paper and say good luck.
Yeah.
Yeah.
Yeah. Well, a lot of the times with these weight loss medications, consider yourself lucky if people are handing you a piece of paper, because a lot of the times it's just an electronic prescription and have a good day.
Yeah.
But we're trying to change it, right? Yeah. We're trying to change the whole narrative on obesity medicine, on education, understanding also that you don't need to be diagnosed with obesity to be on this type of medications, on GLP-1s.
Right.
and that there is a lot of use for people that are not struggling with obesity.
Right. So I think it would be helpful for the viewer. How did you get into obesity medicine?
Oh, so I've always been into wellness. My whole life, I've always paid attention to what I eat. I always look at my body like my temple. I am very, careful in choosing the food that I eat, the nutrients. I like whole foods. I try to avoid artificial ingredients. So that was always a path. I'm very active. I've loved to exercise, but specifically, many years ago, I used to do medical missions, and I would travel to countries that struggle with malnutrition and obesity. And it was fascinating to me to see that, like at the early ages of life, at the school age, when the children were little, school age, were struggling with malnutrition in remote areas. But then if you come back to the same areas years later, those same children that struggle with malnutrition, fast forward, they were developing overweight and obesity and comorbidities that came with it. So this was way before obesity medicine was a thing, and that I've always been fascinated. I mean, we knew that like obesity was going to be the new pandemic.
Right.
So,
Yeah. I think that's important because I think that right now in the culture these medications are very well known, but I think that what people fail to understand is that obesity medicine has been around for a while and we know a lot of information, and at the same time we're still learning. So if we're talking about an area that we're still learning about, can you talk to us a little bit about the relationship between the menopause life transition, weight gain, weight loss medications, and potentially the relationship between hormone replacement therapy, weight loss medications, and weight gain for
well, there's
women life?
definitely a use for GLP-1s, weight loss medications on perimenopausal and menopausal weight gain. Especially this type of patients that, are doing everything they can. They're exercising, they're eating right, and they're still struggling and gaining weight. And we already know what are the metabolic changes that are happening at this point with the changes in hormone levels. We know that fat increases, muscle decreases. So we know that, right? And GLP-1s play a very good role in helping people maintain their weight, kind of keep their fat mass at a normal level. And most of the time, we could achieve this with very low doses. Now, there's new studies coming out, there's new research coming out looking at the use of menopause replacement therapy together with GLP-1s and analyzing metabolic health. Because we know that perimenopausal menopause interferes with metabolic health. We know during this time, fat mass goes up, and then the things that come after is cardiovascular disease, which we know that is the number one cause of death in women, and that comes with fat plaques accumulations and all of that. And we know GLP-1 definitely plays a role, but then the studies are looking at that the concomitant use of GLP-1s together with menopause replacement therapy shows significant improvement still on their metabolic health.
Very promising.
So yes.
Yeah.
So they could find me on my website, New York Weight Wellness Medicine. Instagram is Dr. Dina Peralta, and in Facebook, New York Weight Wellness Medicine, and in the Upper East Side next to the Guggenheim.